Experts try to answer that question.
Yeah, guys, it is a tough question. A lot of people want to know. Dr. Hahn is the Senior Director of Medical Analysis, Medical Affairs, I should say, at Healthline. Before that, she spent years in clinical practice, and she's joining us live via Zoom. Good morning, Doctor. We don't have a ton of time, so I want to get right into it. First of all, when we see this increase in cases, based on what you have seen, what do you think is driving the increase so far?
Thank you so much for having me here, John. So that question has been coming up a lot recently. There's a question as to whether or not the increase is due to increased available and testing. In actuality, what we're actually seeing is the increase may be due to the fact that we're opening up the economy more and people are getting a little bit more relaxed in terms of diligence with physical distancing and the use of face masks. If anything, when we track hospitalization rates and death rates, we're actually seeing that those rates are remaining steady and that they are much better indicators of what the true incidence is in the community.
And is that maybe for us folks who are not in the medical business, is that the number we should be focusing on more, is hospitalizations and ICU beds? Is that really the more accurate metric to watch?
Indeed. With Healthline Media, we track COVID rates all the time, and we found that the hospitalization and death rates are the best indicators of how much COVID is in the community and how well the community is adapting and supporting the people. It suggests how well the healthcare system is able to quickly pivot and mobilize should there be increases in cases as the economy further expands and reopens. So those would be the best indicators and metrics to track.
As we know, the governor here in this state has mandated masks when you're out in public places. Some people say, look, that they don't work. They don't protect people from the virus. What is the best, latest medical data you have on the efficiency and efficacy of masks?
Well, in actuality, the masks are not meant to protect you per se. The masks are meant to protect others around you if you're not able to practice physical distancing and maintaining a distance of at least 6 feet. Because what we've seen from the data is that COVID-19 is very much an airborne virus, meaning we're not seeing it really transmitted on surfaces like we'd originally seen. We are actually seeing it more in the air. And whatever you can do to be physically distant and to prevent that airborne transmission of the virus through talking, coughing, or sneezing can actually help limit the transmission in the community from person to person.
All right, Dr. Hahn, thank you so much. We appreciate it.
Thank you so much for having me.
All right, guys.
All right, very good.